So today we're gonna start another important topic, which is actually oral facial pain. So let's start it. Bismillahirrahmanirrahim. Pain. So what is basically pain? Pain is an unpleasant sensory or emotional experience. Means it is unpleasant. No one liked it. Sensory means you have a sensation. Emotional experience which is associated with an actual or potential damage means you have a damaged because of that specific feeling that actually protects from nauseous stimulus. Yes, actually also if you touch a hot or you touch a hot pot, so you have an instant feeling it is hot, not to touch more. So basically to protect from the nauseous stimulus. Okay, now there are different type of actually nerve fibers you have studied in your basically in your 9 10 even first and second year. These are different type of neurons. This is basically the nerve supply of the face. You know basically that these are the nerve supply of trigeminal nerve and ophthalmic, maxillary and facial branches are of the trigeminal nerve. Okay, then there are pin fibers. So basically you have two type of fibers, a delta fiber, which is small myelinated fibers and that transmit sharp pain. Okay, C fibers, which are small unmyelinated and fiber that transmit dull itching pain. Means if they are myelinated, so it will actually transmit fast and sharp pain. But if it is not myelinated, so the speed of the pain is slow and dull itching pain is this. Okay, now pain fibers A delta are fast, which I have told you, and are for pain, touch, pressure and temperature. Means they are for your pain. You can feel the pain, you can feel the touch of something, you can feel the pressure of that, then you can feel the temperature impulses. Then impulses are handed over by class A delta fibers and travel approximately 16 to 49 feet above 5 to 10 meters per second, and C fibers are slow because of their unmyelination. They are unmyelinated. Okay, now these are actually different type of structures. These are basically the pathways. We will not discuss, we have to just, you should know the overview. These are actually pathways you have studied in your physiology. The pain pathway, which is very important, how the pain travels actually. Classification of pain. When it is acute, so means hour to days. When it is chronic, it is month to years, and which is it then it is referred. Then causes of orofacial pain. Number one, you have dental pain. Either you have pulpitis, irreversible or reversible, cracked tooth. Okay. Periradicular pathology means you have some pathology in your periradicular area. Pericoronitis patient has, and dry socket have also pain. Then pathology with associated structures like salivary glands, you can have pain. Paranasal sinuses, eyes, cervical spine disorder, nasopharynx and ears. Okay, basically you have pain. Then you have neuropathic pain disorders like trigeminal neuralgia, glossopharyngeal neuralgia and postherpetic neuralgia. Vascular disorders, you have migraine, you have headaches like cluster headache is you have tension basically type headache, giant cell arteritis. Psychogenic pain, facial pain is like atypical facial pain, intracranial lesions, neoplasm and multiple sclerosis and referred pain from the remote site. So you have dental pain, you have basically pain with associated structures, neuropathic, you have vascular, psychogenic, intracranial and referred pain is present. Diagnosis is basically you will do history examination and then you do investigation like x-rays, percussion tests on teeth and vitality tests is again for the teeth to know whether the tooth is vital or not. Vitality. Now the history of pain. How will you take the history of pain? Number one, take the history. Complaint you should know. Then you will take about pain history. Pain history is your basically that Socrates. You should know the site. You should know the onset. You should know the character, radiating factor, associated duration, exacerbating factors, and relieving factors and severity. Once there is an onset, so again Then you should know the modifying factors which I have told you, aggravating factors or elevative factors. Effects on lifestyle, whether it affects or not. Either it affects your mode of depression or anxiety. Outcome of previous investigations and therapies, means you have taken any medication, what is the result of that. And then the consider the use of visual analog linear pain scale and a pain questionnaire. Ask that from that basically scale the pain from 1 to 10. Dental history you should take, you should have the medical history, and you should also have the social history of that. Again, this is the Socrates which I have told you. Then again, location, duration, location, radiation, provoking factors, associated factors, periodicity, character, severity, and relieving factors. Now examination, basically odontogenic structures, means those structures which are actually tooth related. So you will do basically examinations of those actually structures. Now you should know the dental test status. Then the pulp vitality test and static and dynamic occlusion relationship, means you will check the occlusion, the related structures and muscles of mastication, TMJ, salivary glands, sinuses, and cranial nerve functions like trigeminal, facial nerve. Gross tests of selected or all cranial nerves. Sensory, you will check the sensory defects. You will do investigations, and basically you will do the radiography and other imaging tests also. Hematology means you will do blood tests to know clinical chemistry, ESR, vitamin B12, virology, diagnostic occlusal appliances, biopsy, psychometric questionnaires, nerve conduction tests, again trigeminal, diagnostic local anesthesia, nerve block. You will check this actually, and define the distribution of pain, whether the pain is confined or it is basically diffused. Deferred pain requires further information, and from general practitioner, specialist, and hospital case notes. Management, how you manage this patient. Establish the patient's treatment goals. What is the basically the patient's treatment goals and likely adherence to the therapy. Then elimination of odontogenic pain, those the pain which is related to the tooth. Investigate or address the restored tooth or occlusal adjustment or extraction. Medical treatment like drug, you should have drug therapy, carbamazepine, and antidepressants. Refer to appropriate specialist for neurologist for the nerve conduction test. Establish the means, what is the patient's treatment goal number one. Then eliminate the odontogenic pain, medical treatment drugs, and refer to appropriate specialist. Then you have